My name is Amna Dermish. I am the Chief Operating and Medical Services Officer for Planned Parenthood of Greater Texas. I'm an OB/GYN by training with a specialty in complex family planning. In the 11 years that I've been here, it has been a continuous cycle of restrictive legislation. It has constantly felt like we were just fighting this unending battle to keep access to care. And it's just hard not to get emotional remembering it. And now we can't do anything. And it felt like for the longest time that every day I could show up into this clinic and see patients, I was winning. And then Dobbs just felt like it took that away. I mean, SB 8 was devastating though. Every day, half the patients I would see, I'd have to turn away. And that was just the hardest thing as a physician, to have a patient in front of me who I had the capacity to care for. And I had to turn them away. I still am not over it. It was horrible. I was having panic attacks every day. No healthcare provider should ever be in that situation. And more importantly, no patient should ever be in a situation where their healthcare provider is able to provide them care and is held back by the government. I mean, these legislators are clearly not speaking to healthcare providers, and if they are, they're not speaking to healthcare providers who actually provide this care, who understand what it means to take care of a pregnant person who has a complication, or to take care of a person who's pregnant and can't be, for whatever reason that be. I would invite any legislator to spend a day in the health center with me and talk to all of my patients with me, and then walk away and say that these laws are still good laws. You cannot legislate health care, but yet abortion and pregnancy care is singled out for legislation. And we are seeing the harm that is coming. We have been seeing the harm that comes out of it. What we have done in this country is we have failed to protect that right to self-determination. We have failed to say to citizens of the United States that we trust you to make these decisions about yourself. And so now we're in a situation by virtue of luck, where you happen to live, or the resources that you might have as an individual dictate your access to this right. I love providing this care. I love providing abortion care. I think it's so important because it's so hard to access and to be able to be, there's so much stigma in abortion. There's so much stigma in pregnancy and parenting, and abortion in particular, there is so much stigma. And so one of the joys of this work is to be able to remove some of that stigma for someone, just to create a safe space where while you're here in this clinic, while you're here in this room, you are safe, we care for you, we trust you, and you deserve this care. And that is the great joy of this work, and I miss it.